the catastrophic violation of children's rights, COVID-19 school reopenings, and the devastating loss of biological parents, them before us, and Rigney perspective, them before us, based on their established scholarship advocating for the child's right to their biological parents, would unequivocally condemn the premature and inadequately protected reopening of schools during the COVID-19 pandemic. They would view it as a catastrophic policy failure, a direct assault on children's fundamental rights, akin to the harm caused by divorce and surrogacy, as it resulted in the profound and irreversible loss of parental figures. Just as they argue that divorce intentionally fractures the biological family unit, and surrogacy commodifies and separates children from their biological origins, they would contend that school reopening policies intentionally risked the loss of biological parents. Joe Rigney, drawing from his scholarship on biblical family structures and parental responsibility, would see this as a failure to uphold the God-ordained family and a dereliction of parental duty to protect children, a responsibility outlined in Scripture, a similar disregard for God's design they would find in the intentional disruption of family through divorce and surrogacy. The indisputable data, a global tragedy of orphanhood, them before us, and Rigney perspective, them before us, grounded in their advocacy for biological family integrity, would point to the cold, hard data as a testament to this injustice. The over 10 million children robbed of their parents represent individual tragedies, highlighting the severe consequences of policies that disregard the importance of biological ties. This echoes their arguments against the long-term emotional and psychological harm inflicted upon children of divorce or those born through surrogacy, who often grapple with identity issues and feelings of abandonment. Joe Rigney, reflecting his theological framework, would see this as a manifestation of the consequences of societal sin and a disruption of the natural order established by God, a similar disruption to that of divorce and surrogacy. The unconscionable transmission chain, children as vectors of loss, them before us, and Rigney perspective, them before us, consistent with their arguments against policies that separate children from their biological parents, would highlight the dangerous narrative that children are resilient and less susceptible to harm. They would condemn the policies that turn children into vectors of transmission, leading to parental loss. This reflects their stance against the adult-centric view that prioritizes adult desires over children's fundamental needs, a view they also oppose in divorce and surrogacy. Joe Rigney, in line with his emphasis on the consequences of actions, would see this as a disregard for the lasting damage that occurs when the natural order of the family is disrupted, and a denial of the consequences of human actions, much like the disregard for consequences they would see in divorce and surrogacy. Consider the following scenarios, each a harrowing illustration of this injustice. Scenario 1, the child as unwitting agent of loss, the story of Sarah. Sarah, a bright and energetic 8-year-old, was sent back to her third grade classroom in the fall of 2020. The school, eager to return to normal, lacked adequate safety measures. Pediatric N95 masks were scarce, and vaccines were months away. In her crowded classroom, Sarah contracted COVID-19. She returned home, unknowingly carrying the virus. Her mother, a single parent with a history of asthma, cared for her. Within a few weeks, Sarah's mother was hospitalized and then tragically passed away. Them before us would assess this scenario as a devastating example of how policies prioritizing adult convenience directly violate a child's fundamental right to their biological parent. They would draw a parallel to the deliberate separation caused by divorce or surrogacy, emphasizing the irreversible loss Sarah experienced. Joe Rigney would view this as a tragic consequence of societal choices that disregarded the sanctity of life and parental responsibility, akin to the moral failings he sees in the intentional fracturing of families. He would stress the divine mandate for parents to protect their children, a mandate ignored in this case. Scenario 2, the ripple effect of tragedy, the chain involving Tommy and Miss Jones. Tommy, a 10-year-old, attended a school where social distancing was difficult and mask mandates were loosely enforced. He contracted COVID-19, and though he experienced mild symptoms, unknowingly spread the virus to his teacher, Miss Jones. Miss Jones, in turn, infected her elderly father, who lived with her and relied on her care. The elderly man, weakened by age, succumbed to the virus. Though Tommy never directly harmed his own family, his role in the transmission chain led to the loss of a grandparent. Them before us would assess this as a clear example of how the ripple effect of poorly considered policies can devastate families. They would emphasize the systemic failure to protect the most vulnerable, highlighting the disruption of vital familial bonds, similar to how divorce disrupts extended family relationships. Joe Rigney would see this as a manifestation of the interconnectedness of society and the consequences of choices that disregard the well-being of the vulnerable. He would point to the biblical emphasis on honoring elders and the responsibility to protect them, a responsibility that was not upheld. Scenario 3, the betrayal of trust, the case of Michael and Dr. Smith. Michael, a 5-year-old, was taken to his pediatrician, Dr. Smith, for a routine checkup. Unbeknownst to anyone, Michael was in the early stages of COVID-19 infection. Dr. Smith, exposed during the examination, contracted the virus. He then infected his wife, who had an underlying health condition. She tragically died. This scenario represents a profound betrayal of trust, a violation of the sanctity of the doctor-patient relationship. Them before us would assess this as a stark example of how the adult-centric policies of the time harmed the innocent. They would highlight the profound breach of trust, drawing parallels to the broken trust in family relationships caused by divorce and surrogacy. Joe Rigney would see this as a consequence of a society that has lost respect for the sanctity of life and the importance of professional responsibility. He would emphasize the biblical mandate to care for the vulnerable and the consequences of failing to do so. The multi-generational catastrophe, the destruction of family stability, them before us, and Rigney perspective. Them before us, based on their scholarship, would emphasize the egregious impact on multi-generational homes, highlighting the importance of extended family structures for child well-being. This echoes their arguments against divorce, which often disrupts these vital support networks. Joe Rigney, reflecting his emphasis on generational covenant, would see this as a breakdown of the essential role of elders, a role he would say is undermined in surrogacy as well. The silence of the advocates, a betrayal of children's rights, them before us, and Rigney perspective. Them before us would condemn the conspicuous silence of many voices, including themselves, Joe Rigney and others, as a betrayal of their stated principles. This silence, in the face of such a profound violation, is akin to the silence they perceive regarding the harm caused by divorce and surrogacy. Joe Rigney, consistent with his moral leadership advocacy, would view this as a failure to speak truth in the face of injustice, similar to the moral failure he would see in those who do not speak against divorce and surrogacy. The indefensible balancing act, educational benefits versus irreversible loss, them before us, and Rigney perspective. Them before us, given their focus on the child's right to their biological parents, would argue that the notion of balancing educational benefits against the risk of parental loss is morally bankrupt. This is a similar argument they make against the benefits that are sometimes used to justify divorce or surrogacy. Joe Rigney, reflecting his emphasis on God-given priorities, would see this as a gross misapplication of values, a similar misapplication he would see in the justifications of divorce and surrogacy. Updated and expanded analysis integrated long-term impacts and the resilience myth, then before us would emphasize the long-term consequences consistent with their child-centric approach, and their arguments against the long-term damage caused by divorce. The role of mitigation measures and the question of adequacy, them before us, would demand a risk-averse approach, prioritizing the child's safety, much like they advocate for safety for children in surrogacy. The disproportionate impact on vulnerable populations, them before us, would advocate for addressing systemic inequalities, similar to their advocacy for children who are born from surrogacy, who are more often than not from lower economic backgrounds. The global children's rights movement, them before us, would advocate for a global movement prioritizing child rights, which includes rights against divorce and surrogacy. Applying the rubric to future pandemics and public health crises, them before us would insist on policies prioritizing biological parent rights, a policy they would extend to all family matters.